And Nigerians have been warned to be on high alert in their purchase, handling and consumption of animal and related products. The Veterinary Council of Nigeria made this known following the report of an index case of the anthrax disease in Suleja, Niger State. Lara Fulayo reports.
A few weeks ago, the agriculture authorities alerted the public on the outbreak of the anthrax disease in northern Ghana. It subsequently warned the public to desist from consuming animal hides and other products such as bushmeat, as the disease had a high chance of entering Nigeria by way of transportation of livestock across borders. The country's fears were confirmed on Monday as the index case of the disease was reportedly discovered in a multi-species farm which breeded cattle, sheep and goats in the Suleja axis of Niger State.
A vet actually discovered that some animals were sick and they were being slaughtered and will almost be passed for human consumption, and the vet stopped it and then reported to her principals, and samples were taken and it was confirmed positive for anthrax.
The agriculture authorities say they are working with the Niger State government to contain the outbreak spread. This is by way of quarantine of the affected farm, as well as deployment of anthrax spores vaccines to the affected farm and others within close proximity. It is also educating farm workers on symptoms, prevention, and how to handle suspected cases.
So the situation is that the veterinary authorities are at the scene. They are also trying to probe further, doing trace back, in making sure that, because those animals would have come from somewhere, or part of some of the animals would have been slaughtered before that incident.
Livestock owners have also been warned to apply caution when purchasing animals like cows, camels, sheep, goats and other livestock from states bordering Benin Republic, Chad, Ghana and other West African countries. The public is also advised to be careful with consumption of meat products.
We have to get our meat from reputable sources. We must also get our processes of cooking right.
Generally speaking, when microorganisms are thrown to heat, that is boiling, it may reduce their potency to cause disease. However, in this case, let's be cautious because anthrax is a very deadly disease.
The agriculture authorities have assured of plans to vaccinate cattle, sheep and goats nationwide against anthrax while enhancing surveillance in livestock farms, markets and abattoirs. They, however, want livestock owners to report suspicious illnesses or deaths of animals while avoiding contact with sick or dead animals and their products. Lara Fulayo, TVC News, Abuja.
I have joining me on the news at 7 to discuss the first case of the anthrax disease in Nigeria, Head of Communications, NCDC, Dr. Yaya Disu. Thank you for joining us on the program, Dr. Disu. What's the update with the index case from discovering a case in Suleja? Has there been any update as we speak?
Well, thank you very much for having me. We've not heard of any other new case, but from human aspect, we're creating awareness and then preparing to ensure that we don't have spread to human population. And the human exposure that's occurred is we have been able to identify, working with colleagues in the Federal Ministry of Agriculture and Rural Development and the State Ministry of Agriculture, to Ministry of Health, State Ministry of Health in Niger State, to identify those human who are in contact with those animals, and they are following them up to ensure that they don't develop. If they develop the symptoms, they're able to detect it early, but they also make sure that they treat them.
What's the implication of having a contact with an infected animal?
Can you repeat that? The volume is low.
I'm asking what the implication is if you have a contact with an infected animal.
Okay. The implication is a zoonotic disease, and it can be transmitted from animals to human. It now depends on this route of transmission. If it is something that comes in through the skin, if the spores gets in contact with the skin, it can cause a skin lesion. And then, of course, the incubation period for that is about 1 to 7 days. And then, but it can still also spread to other parts of the body once it enters the skin. And then also, it can also come through inhalation, through respiratory system. And then that can also cause severe illness. Another way is if human ingests this, and then it can also affect the gastrointestinal system, as in diarrhea and so on. So it can also cause mortality in humans. But the important thing is that we take all the necessary precautions in terms of hygiene and then minimize contact with areas where you already have transmission established. And then also let's wash our hands, maintain personal hygiene, cook our food very well, and avoid touching animal or dead animal. And then make sure that we report that to veterinary authorities around us. If we can't get one, then we can also report to health facility, which can also quickly contact the veterinary authorities.
So what is being done now in the area where the index case was discovered? Because we understand that this bacteria produces dormant spores that can live in the environment for many years.
Well, the Federal Ministry of Agriculture and Rural Development, working with the state counterparts, that is the State Ministry of Agri, are working with all the relevant stakeholders, the Ministry of Environment, Health, to ensure that we don't have transmission and they take care of the environment, bury the carcasses, follow the infection prevention control measures. All the necessary biosecurity measures are being put in place there.
Some Nigerians are paranoid as we speak as to what to buy, what to eat in the area of meat and livestock. What do you have to say to them?
Well, advisory from the Federal Ministry of Agriculture and Rural Development says that one, if they see any sick animal, they should try and avoid touching them, or when you just see a dead animal. You may also be rearing animals at home, and then when you just see that they just die in mysterious death, you don't touch them. What you just do is call the veterinary authorities who will come and do the necessary, take the necessary actions to protect everyone. And then again, if you want to buy meat in the market, or inspect the meat, make sure that it is healthy. And then once you see any strange color or smell, then what you just need to do is don't buy such meat. And then we all have the duty to report when we see deviation from normal
It's hard to tell which meat is infected or not anyways, but that's our time. Dr. Yaya Disu is the head of communications of the Nigeria Center for Disease Control. Thank you for your contribution on the news tonight.